everyone. It's great to see you all. Fantastic to have you with us. For this sort of one of the first of our webinar series, really. So this is a really exciting development for greener practice, and we are absolutely thrilled to have Shireen Kassam with us to talk about the Eat Lancet 2 report that's just come out. Shireen is a haematologist at King's College London, and she's an expert in lifestyle medicine, and particularly an expert in plant-based nutrition. So we really are very lucky to have her. I was looking at your resume on one of the websites, Shireen, and I was exhausted just looking at your list of publications. It was quite extraordinary and really amazing. So we're very excited to have you here today, and I'll let you kick off with your talk. So we'll probably have about 40 minutes, so 30 to 40 minutes of talking, and then we'll have time for questions. If people can put their questions on the chat, that would be really helpful. We can unmute you if there's something we want to sort of clarify your question anyway, but otherwise I was just we'll just keep you on mute and put your questions in the chat, and I'll keep an eye on those as Shireen's talking. So without further ado, I'll hand over to Shireen.
Brilliant. Thanks ever so much for the invitation. Really admire the work that Greener Practice are doing and have benefited it for myself as well, and definitely recommend your new platform, which looks amazing. So it's great to be here. I'll just check you're able to see my slides and see them changing. That all looks okay. Great. Thanks. That's a hands up. Just going to minimize the little square. So thanks ever so much for the introduction. So just in terms of disclosures or conflicts of interest, I do run a non-profit organisation, a CIC, a bit like Greener Practice, called Plant-Based Health Professionals UK. And I guess it's in that capacity that I'm speaking to you today. We provide education and advocacy on healthy plant-based diets and lifestyle medicine to improve health of both people and the planet. I am sustainability lead for pathology practice at the RC Path. So if and when you're interested in learning about sustainable pathology practice, do feel free to reach out to me. And I do provide education on plant-based diets and separately on cancer and lifestyle medicine at the University of Winchester. And I'm an author and vegan since 2013. So in the next 40 minutes, I thought I would cover the following. A reminder, because I'm sure it is a reminder, of the impact of the food system on personal and planetary health. I'm then going to cover the relaunch of the Eat Lancet Planetary Health Diet, the 2.0 that was relaunched on the 4th of October. And then a call to action to all of us, really, and hopefully some resources and practical implementation for all of us in whichever area of practice we're in. It may be self-evident, but it's sort of worth recapping why are we talking about food today? And our food system really is a key driver of all these current and interrelated issues: health, climate breakdown, biodiversity loss, antibiotic resistance, pandemic risk, air pollution, and of course, it's a justice issue, which was one of the key highlights of the Eat Lancet relaunched document. And of course, I can't cover all of this, but just to highlight how important our food systems are. But what was made clear at the launch of the Eat Lancet 2.0 was that the Earth is now beyond 7 of its 9 planetary boundaries. So these are boundaries which we should be keeping within to be in a safe operating space. And you can see in this orange colour how far we've transgressed with 7 of the nine planetary boundaries that was the term coined by Johan Rockström, who's the lead author of the Eat Lancet. But importantly for today, food systems are the largest contributor to transgression of 5 of these 7 planetary boundaries. So without addressing food, we cannot bring ourselves back into safe operating space. So it's absolutely clear that globally and in the UK, to meet our climate and nature targets, we need to change our food systems and the diet we eat. And this is a diagram from WWF. Current diets, the CO2 equivalents per person needs to at least halve by 2030 if we are to meet these targets. And Eat Lancet said no safe solution to climate and biodiversity crisis is possible without a global food systems transformation. So that is absolutely clear. So what does it mean? I mean, well, what we eat really does matter. What we farm really matters. But I guess, you know, in healthcare, we're more about supporting people to make effective, healthy and sustainable diet change. So what we eat really matters. You can see here on the left that as we progressively remove animal source foods from our diet, going from a typical Western diet to a vegan or 100% plant-based diet, we can reduce the impact on the planet by around 75%. So put another way, a vegan diet or a 100% plant-based diet has 25% of the impact of the typical British diet. And whatever move you make is beneficial, with removal of red meat and dairy the most impactful. But of course, we don't want to talk about what we're removing. The fact is, we'll come to in a minute, that emphasizing plant-based foods in the diet will improve so much of our health and well-being. And it's similar for milks. You know, swapping out dairy for any type of plant-based alternative, if you choose to drink milk, is better for all aspects of climate health. So just turning to health, our current dietary pattern is not really fit to support our mental and physical health and well-being. So this is data just from this year. It's the National Diet and Nutrition Survey. Less than 1 in 10 children and less than 1 in 5 adults actually eat 5 portions of fruit and veg a day. Only 4% of children and adults meet their fibre recommendations of 30 grams per day. And overall, children and adults are over-consuming saturated fat, which mainly comes from animal-sourced foods, and over-consuming foods that are high in sugar and salt. And as a consequence, this report on the right was published at the end of last year from the Food, Farming and Countryside Commission. We have a huge cost to the economy and healthcare. And this was modelled by looking at the costs to health, the climate, the economy, welfare, social care, and loss of productivity. And this astounding number of 268 billion a year due to our unhealthy food habits. Now, of course, this isn't an issue around personal choice, it's around the food system and the food environment, but that's a figure that's more than we spend on the NHS at the moment, so it's pretty eye-watering. So what is the solution to our planetary and health issues when it comes to diet? Well, we don't have to do the work. The work was done back in 2019 at the first launch of the Eat Lancet Commission, and now been relaunched with very little change, but articulating some of the criticisms that came out of the first report. And what you see here is a new planetary health plate on the left-hand side that's half fruits and vegetables, around quarter whole grains, and mostly plant sources of protein. And if you are going to eat animal-sourced foods, they should be minimized and around maximum 13% of calorie intake. So that amounts to 1 portion of red meat a week. So that's 14 grams a day. So like a beef burger patty once a week, 2 portions of something like chicken, 2 portions of fish, 2 eggs, and allows for 1 portion of cow's dairy a day. And it's estimated that this would save the 15 million premature deaths globally that occur every year due to adverse dietary risk factors. Now, it doesn't matter what you call this. I think this was the key for the relaunch, that this is adaptable to all cultural traditional diet patterns. The name you give it really doesn't matter. And I think Planetary Health Diet is absolutely fine. And just a reminder that the diet was put together purely based on health outcomes. It just happens that it will also keep the planet in safe operating space. But you can call it flexitarian, pescatarian, vegetarian, vegan. You can meet all of these requirements in any way you want, including 100% plant-based diet. Now, for me, it seems that this also aligns with all of our priorities in the NHS. We've read in the long-term plan, the 10-year health plan, that we want to address prevention, make that the cornerstone, and clearly we need to address our unhealthy diets. We continue to have a commitment to net zero. We accept that that healthcare for humans also has to include health of the planet and the animals we share, so the One Health approach. I will show you that shifting to a planetary health diet has financial savings, not only from the food that we purchase, but also due to the downstream positive effects on healthcare. Plant-based diets, or ones that are centered on predominantly plant-based foods, are much more inclusive of cultural and traditional diet patterns and religious beliefs, and you can make it a just food and dietary pattern, because food justice is really at the heart of the Eat Lancet Planetary Health Diet. There are numerous benefits of plant-based eatings, and I've had the pleasure to speak to you before around this, and these haven't changed. You know, we know that a plant-rich diet, as depicted by the American College of Lifestyle Medicine, who sets the curriculum for lifestyle medicine, it's one that is centered around minimally processed plant-based foods. It doesn't matter what you do around the edges, the bulk should be fruits, vegetables, whole grains, beans, nuts, and seeds. And of course, this is high in fiber. It helps satiety and body weight. It reduces your risk of type 2 diabetes, cardiovascular disease. Even now, it's clear it's useful for reducing future risk of dementia, given heart risk factors are also risk factors for dementia. And it can support health across all ages and stages of life. And this is also what the Eat Lancet addressed this time. It did go through all the life stages and any vulnerable times during our life, such as during pregnancy, lactation, children or older adults. And you'll see if you read the document that what they've done is strengthen the health-related evidence. And this is just summarising some of the papers that have come out between 2019 and 2025, in that that have looked at adherence to the Planetary Health Diet and impacts on health outcomes. And what these studies have shown, albeit mostly observational, that you can positively impact all-cause mortality, cardiovascular and cancer mortality, reduce the risk of respiratory and neurodegenerative diseases, reduce the risk of type 2 diabetes, and in different ethnicities. So we've got studies in Black people and South Asians, which is really important to show. So what does this new relaunch do? Well, it first and foremost, like I've said, puts justice at its heart. But what it does is bring together the latest evidence, and actually the evidence has only strengthened to show that this way of plant-rich eating is good for people and the planet. It emphasizes cultural adaptability. It measured the impact of the food system on all planetary boundaries this time, and I've demonstrated that really current food systems is having a negative effect. And it introduced this global modelling to see how we could feed 10 billion people within environmental limits. And of course, it put justice at its heart, and that's thinking about fair wages, fair access to food, fairness for people who are working in the food system. And it reiterated the benefits for chronic disease, planetary health, but also it's worth us noting that it modelled that it would reduce antibiotic reduce in our food systems by 42%, because of course, globally, 70% of antibiotics are fed to animals, and the farming system, the way it is at the moment, requires this sort of unregulated use globally. And this would reduce the use if we reduced our consumption of animals. And of course, it would also ensure a decent work, decent wage, right to food, and a healthy food environment. So what we had the pleasure of being involved in as Plant-Based Health Professionals UK is one of the NGOs involved in putting together the Eat Lancet action brief for healthcare professionals. So there were communities of practice that were put together by the Eat Commission. And one of these communities was healthcare professionals, because what they really wanted this time around was to have action from the recommendations, which has been missing in the last 6 years. So there's this document, you're welcome to have my slides and the references, that really tells healthcare professionals how to implement this. But what's clear is that our trusted role in society means that we are key change makers if we want to see the food system transition from something that's harming the planet to one that's supporting health and the environment. And there's numerous calls of action and recommendations. So we need to be promoting healthy, sustainable, just diets for preventing and treating medical conditions, because I've shown you already the harm that's happening. Dietary risk factors are now the leading cause of chronic ill health and premature mortality around the globe. 27% of all deaths are linked to unhealthy dietary risk factors. That's premature deaths. We need to recognise, and we certainly do as an organisation, the strength of dietitians and nutritionists as essential members of the multidisciplinary team to drive the dietary shifts. We need to embed this into our education, training and practice, and we all agree that we need to reorientate the healthcare system into prevention and bring nutrition care into routine care. Now, some countries have already updated their guidelines, and probably since 2019, there's been about 17 countries that have updated their guidelines, dietary guidelines, and incorporated many of the recommendations from the Eat Lancet Planetary Health Diet into that. We haven't as yet, and one of our pieces of work is to make a case to SACN and OHID to start considering an update, because the Eat Well Guide published in 2016 doesn't specifically cover environmental sustainability, albeit if we were to shift to eating that way, it would be better for the planet. But these are some of the guidelines that I've liked, and I still think that the 2019 Canada Food Guide is almost perfect, in that it very much mirrors the Planetary Health Diet, and 75 to 80% of the energy recommended is from plant-based foods. We all take inspiration from Denmark, who've now the government multi-party agreement to transition to a plant-based food system. They've got the plant-based action plan endorsed by government, and their dietary guidelines say eat plant-rich, varied, and not too much. And I think we should all come together around that message. And I picked the Nordic guidelines, but we've recently had an update from the Netherlands that specifically tells citizens to shift from animal source proteins to healthy plant sources of protein. And although we haven't had an update to our guidelines, what we have had is numerous documents and endorsement from our health and government policymakers that we should be also championing plant-rich diets. So there's a series of articles around applying all our health, called Climate and Health and Healthy Eating, that all say that the current food system is not fit for purpose, that a diet rich in plant foods is better for health and the environment, and if you limit consumption of animal products, it is perfectly possible to eat a varied diet and get all your nutrients for all stages of life. And Greener Practice, like Plant-Based Health Professionals UK, is a member organisation of the UK Health Alliance on Climate Change, and they've been very much championing prioritisation of plant-based and sustainably sourced food as one of their climate commitments. And I was lucky enough to be able to contribute to this year's Lancet Countdown UK policy priorities that UK Health Alliance on Climate Change put together. And the second priority, rightly so in my mind, was around food system transition. It's timely for us at the moment because we've got the National Food Strategy supposedly going to be putting out recommendations next year. We've all been trying to, get our voice heard. And what the Lancet Countdown recommendations for the UK say is a national transition to plant-rich diets, and that this should be in our procurement on catering in schools, hospitals, and public institutions. And I'll come back to some of the work we're doing in hospitals. This is already in our medical curriculum when it comes to education for sustainable healthcare. It recognises food as medicine, plant-based diets for health and planet, and the current harm that's being caused by food systems for all those reasons I listed at the start. So we've got a really good basis on which to develop our practice and action here in the UK. So just wanted to reiterate what we're about in Plant-Based Health Professionals. Sorry, busy slide, but ultimately we believe as an organisation to witness the transition to a plant-based food system, we need healthcare professionals to accept and adopt a plant-based diet and healthy lifestyle as one that can benefit themselves, so us, the patient and the planet. So we as an organisation, we provide that education, advocacy and initiatives to see that transition, because our vision is that healthcare professionals will use their knowledge, status and credibility to accelerate this urgent transition to a plant-based food system. And we've got a poster on our website about who we are, but we're a membership organisation from around the globe, but mainly UK, open to everyone. So do have a look and support our work if you'd like. So part of our work is doing some research to add evidence to the initiatives that we do. And so just to highlight a couple of things we've done. So this publication looked at nutrition training in medical schools, and we'll know we all need more. We're lucky enough to have a curriculum, both the sustainable healthcare one, but also the nutrition one. But our research has shown that we're not really doing enough. Still, on average, most students are only getting sort of 2 to 4 hours, and it's not really practical, evidence-based sustainable education, as in sustainable diet education. And there's a bit of work coming out from the Planetary Health report card that will probably re-emphasize the results from our studies. And then last year we published a survey, nationwide survey on the UK and Ireland of 335 registered dietitians, asking them about their knowledge, beliefs, and attitudes towards the Eat Lancet Planetary Health Diet. So it wasn't about being vegan or 100% plant-based. It was purely around the 2019 Eat Lancet Planetary Health Diet. And the take-home messages were this, and this was regardless of when the dietitian was qualified. So even those that have been qualified in the last 3 years. So most held very positive views around what we're calling a whole food plant-based diet, which is in the sort of framework of the Eat Lancet Planetary Health Plate. But there was considerable knowledge deficits because they did not feel that they were getting this education in their curriculum. They still held some incorrect beliefs around plant sources of protein being incomplete. They were worried about malnutrition, micronutrient deficiency, and disordered eating, and they felt that they lacked the education. And if they were in a workplace environment like hospitals, that they lacked the support in the work environment. So we've got a lot of work to do, and this is our nutrition profession in the UK. And so, of course, we are trying to build on this and working closely with the BDA. So in the meantime, what have we done that you can benefit from, I hope? We've created the credible resources that seem to be missing. So for the last 8 years, I've been teaching at the University of Winchester, have a CPD accredited course that's listed on your toolkit, your sustainable toolkit from RCGP and in the Silver Award. We've got numerous free fact sheets that you can use for yourself and your patients that are, referenced and evidence-based. We have a brilliant podcast that, if you haven't listened to already, will keep you up to date in everything that you need to know about plant-based lifestyle medicine. And of course, we've got my textbook that I co-authored with dietitian Lisa and my sister Sarah that's out there for you to keep yourselves up to date in the field and as a reference point. And as I mentioned, this is now included in some of the credible guidelines. So the Irish College of GPs recommend our courses and our resources, and this Green Impact for Healthcare toolkit that you are all aware of include our fact sheets and the University of Winchester course. We have a free plant-based health challenge that if you've not tried it out, please do, because people do tell us it's appropriate to use with their patients as well. It's daily emails for 21 days supporting people to eat more plants, led by a dietitian, short videos, recipe ideas. And if you look at the data from over 6,500 participants, you can see that we're really achieving some diet shifts with only about 24% of people at the start identifying as vegan or 100% plant-based or whole food plant-based. And then by the 3-month follow-up, over 50% are identifying as eating a plant-based diet, and people refer back to it and things. So I think it's a useful resource that we keep updated. And then we're trying to fill the gap in medical school teaching, and I think we could all do the same when we've got the opportunities to teach about sustainable healthcare. We must mention diet change, since I've told you that without that, we are not going to meet our climate and nature targets, and it will improve health as well. And so we have a student selected module, or SSC, SSM, whatever people call it, called Cooking for the Climate, that's delivered by a multi-professional team, and we've got curriculum that you're welcome to look at. And if you teach in medical schools, please feel free to invite us to do an SSM, because these sort of warm intros work really well for us. And we have the following objectives really to support people to implement the planetary health diet in their personal and professional practice. So be able to describe what it is, explain the benefits, but I think uniquely we do live cook-alongs online with learners in their own kitchen, so people are able to learn the skills to feed themselves healthily, cheaply, sustainably, and we're very much focused in on how to do it really cheaply. So each meal is less than £1 in terms of cost of ingredients. The essentials of the course is that I've said it's multi-professional, it's sort of blended learning online approach. So there's pre-recorded videos, there's live lectures and Q&A sessions, and then the live cook-alongs. And we're flexible depending on how the university want us to deliver it. We've just I just had a very nice conversation with Nottingham University today, and they're going to add us to their catalogue. So we're slowly increasing. That will be our 9th university. So over the last 3 years, we've delivered 14 of these courses, 130 participants in 4 universities. But as I say, we're now up to 9. And some of the results here, what people wanted to learn, what the learners had told us they were interested in, plant-based diet knowledge, no surprise. But it's interesting, isn't it? Because this mirrors everything that's in the literature, that health is a key motivator when it comes to diet change. But also the literature tells us that doctors are a really trusted voice when it comes to diet and lifestyle advice. And after the course, this is just a snapshot of the results. After the course, the learners, the students themselves, were eating less meat and less dairy and eating more vegetables and legumes. So, I mean, and all the other plant foods. So that's absolutely great. And they felt confident or very confident. So that's up to nearly 85% feel very confident in discussing diet with their patients, which is a big change from the baseline. And this is kind of what it looks like. So if you guys ever want to implement this in your learning and teaching practices or with the Greener Practice platform, do let us know, because I think being able to talk from experience about how to implement is really credible for our patients. So, and this is the delicious food. These are food pictures from our students. So it's everything and anything colourful and healthy. I'm just going to move track and talk about public sector catering, because I think many of you will know that we have got an initiative called Plants First Healthcare. But I think public sector catering and food served in healthcare institutions and at healthcare events and conferences are a real opportunity for all of us to educate, role model, normalise this way of eating, showcase delicious healthy meals, be inclusive. And of course, these meals can be allergen free, so it's great for caterers as well. And a lot of our inspiration has come from New York City, but there's also great examples from Vancouver and now from the UK, which is great. But 11 city hospitals in New York have made plant-based meals the default option for all inpatients. And with this model of sort of using choice architecture, behavioural nudges, nothing is removed from the menu. Meat and dairy can be added, but with this sort of behavioural strategy, more than 50% of patients stick with the meal. They retain high satisfaction rates. They've reduced emissions from food, and importantly, the cost of the meals. And a couple of organisations in the UK, so the Office of Health Economics and the Conservative Animal Welfare Foundation, have modelled the cost benefits to the economy and the NHS of shifting to various amounts, so various shifts to plant-based eating. And so just implementing the plant-based defaults in public sector catering could save the NHS 74 million. And if we really significantly made an impact on shifting our reliance on meat and focusing in on healthy fruits, vegetables, whole grains, beans, nuts and seeds, we could have an even bigger saving that's been modelled as high as 2 billion. So what we did to try and evidence the need for our initiative that's called Plants First Healthcare is we had a look last year and published earlier this year at hospital menus as they are now. Obviously a bit of a tall order, and we had to use freedom of information requests to get the menus, but we were able to include 36 hospitals from all 4 nations, representing most of the sort of ICBs there are. So we made sure that we randomly selected, but they came from each of the regions of the UK, including the 4 nations. And we developed a novel scoring system. I should say researchers Izzy Sadler and Alex Bauer, who are part of my team, developed this scoring system, which can be, is open access, so you feel free to use and look at. And we scored the meals. This is purely on sustainability, because we take health as a given, really. And so looking to see whether there's a fully plant-based meals at mains for the smalls, and also then looking at the behavioural nudges that are made to try and prioritise uptake of plant-based meals. And unfortunately, it wasn't great in terms of hospitals are scoring quite low. Up to 50% of main menus that are meant to cater for 95% of the hospital patients do not provide a fully plant-based meal for dinner or lunch. So that needs to change. They're still serving a processed and red meat on all menus, which I would suggest is not necessary at all and would have so many benefits if we were to shift people to eating more beans. So overall, a lot of work to be done. But this is a nice piece of work for us to hopefully then showcase some positive change when we've got more outputs from our Plants First Healthcare initiative that launched in October 2024, with 24 organisations endorsing, including Greener Practice. And this is about bringing this behavioural strategy of normalising and prioritising plant-based meals as the preferred option in staff and in patient menus in UK hospitals. So we had an enormous amount of support, and we spent the last year refining what we're going to do. Needless to say, campaigning can have unintended consequences, and so we've had quite a lot of unpicking to do of people that we may have upset along the way. But pleased to say that as of today, we have formed a Plants First Healthcare Coalition with us, ProVeg, Greener by Default, Real Zero, and importantly, NHS England. So this has now become much more normalised and well articulated with Phil Shelley and the Net Zero Food team, who are actively supporting, whereas the opposite could have been said a year ago. So we're in a good place. And if any of you want to see some of the initial results, we had an article commissioned in the Doctor magazine that comes every week with your BMJ, but it's also free online. But do have a look at this article because it tells the story really nicely in the words of the people involved and the staff at the Royal National Orthopaedic Hospital, which was the first pilot that had actually started before we launched the Plants First Healthcare initiative. So they have a very forward-thinking sustainability manager called Michelle Nolan, who had already contacted Greener by Default, and in their staff canteen, they have been able to use behavioural strategies to normalise and educate around plant-based meals. And in this sort of 3-month pilot, they were able to increase uptake of plant-based meals, reduce the consumption of animals or meat by 33% and reduce emissions by 40%. And now they're taking this forward to default oat milk instead of dairy milk, and they're moving it forward to patient menus as well. And this work is iterative, so this is just the first initial, and then we'll build on it. Currently, there's 2 more pilots going on at the North Mid and at Hampshire Hospital Trust. 37 hospitals associated with the private provider Nuffield Health have completed a pilot and working on the next phase, and results will be forthcoming. And we're hoping to have more and more. So I just wanted to mention another little bit of work that I hope helps everybody that we've done with the UK Health Alliance on Climate Change. So as I've mentioned, one of their commitments is around prioritising plant-based and sustainable source foods. So Sarah Bentley and my team, who's the lead for Plants First Healthcare, has put together this how-to guide of how to bring teams along and caterers for venues in serving plant-based meals as the preferred option at conferences and events. And it doesn't mean you can't serve other foods or have animal source foods on the menu. It just means that you are normalizing plant-based meals that are delicious, nutritious, and full of healthy plant sources of protein as a way of showcasing where we want the food system to move. And I'm really delighted that so many of you are supporting our work, and just another example of how I feel like we're able to show some impact. I think some of you may be involved in the Green Maternity Report, and within that, so their upfront work to inform this report involved finding out where the main emissions were in maternity care, and one of the greatest contributors to pregnancy care is the significant increase in food requirement, which I thought was incredibly fascinating. And so in order to implement green maternity care, one needs to address the food, and so rightly so they've championed sustainable, plant-rich, locally sourced food. They've recommended our resources and told everyone to support the Plants First Healthcare initiative, which is wonderful to see. And then I mentioned at the start the National Food Strategy, and we're lucky enough to work with our partners on a policy briefing. So this was with Food Rise and the Vegan Society. We have a 10-point plan endorsed by, I believe, yourselves as well, because the UK Health Alliance on Climate Change endorsed it. So 48 organisations from health, environment and animal world outlining to the National Food Strategy team at DEFRA what our vision is for a healthy, sustainable, plant-rich food system. And we did have a meeting with one of the team a couple of weeks ago. So we've started that engagement, and hopefully there's a bit more work to be done there. So I am nearing the end, but I've got a few more minutes. So I think our shared learning, is that plant-based diets are a key part of the solution to health and climate crisis. This is now more widely accepted. It doesn't matter what the noise is around the edges. This is the status quo. We need to shift. Healthcare education from our own research has not yet caught up with the science. So we've got a lot of work to do. So we need to be key change makers. We are trusted voices, and we need to normalise plant-based meals in all spheres of where we have influence, but specifically in healthcare, conferencing, catering, and public sector catering. Now, if I may, I just wanted to address some of the criticisms and the myths around the Eat Lancet Planetary Health Plate. So one of the biggest ones that keeps rearing its head, and I'm sorry, but if you follow the money and the people, it does come back to the meat and dairy industry. There's this perpetuated myth that this type of way of eating is nutritionally deficient. I'd like to say that what we do currently is nutritionally deficient, but what we want to do is better. And one of the authors, Nita Faruhi, who works at Cambridge University as part of the Eat Lancet group, has obviously been the senior author in this paper, basically answering that question: what would happen to nutritional adequacy in the UK if we shifted to the Eat Lancet Planetary Health Diet? Great paper to read, do have a look at it. What they've said in the conclusion: we've identified no evidence for increased nutritional inadequacy. Given the urgent global need to shift, our findings are positive and promising, and basically we should be championing this through dietary guidelines and food system incentives. It's unlikely to compromise nutritional adequacy. So I think we should stop describing this way of eating as being nutritionally problematic. The other criticisms or myths that are perpetuated that is stopping action is this sort of narrative around British farming is already sustainable, land used to graze animals can't grow food, animals are required to restore soil health, plant-based diets are highly processed. You'll have heard it all before. And the reason why we have this is because in 2019, in leaked documents to Desmog and published in the Guardian, there was a massive multi-millionaire campaign for meat and dairy to fuel this backlash against the Eat Lancet. And they really went after the authors, threatened them. It was really bad. Marco Springman, who's based in the UK, spoke about it in the media in this article about how he was targeted, it really, well, it was effective. That's all I can say, because from my perspective, I don't feel like the Eat Lancet Planetary Health Diet from 2019 really had the impact it needed to on health and sustainability action. But I want to remind you that our food system contributes to more than 30% of greenhouse gas emissions globally. Animal agriculture is responsible for up to 60% of these emissions. In the UK, 62% of farming emissions come from red meat and dairy. That to me is not a sustainable food system. But then if we think about land, we have turned the planet into a farm. But this is more related to biodiversity. This is why we are one of the most nature deplete countries in the world, because we have turned our country into a farm. The global mass of farm animals is now 22 times the weight of all wild animals. Globally, 60% of animals are farm and only 4% wild. If you think of birds, 70% of birds on this planet are birds raised as food. And if we think of the land in the UK, 85% of the land that feeds the UK is used to graze animals or grow crops. And of course, we'd love to think our animals are all grazing out in the grass, despite the fact that this is eroding our countryside. But the reality is that 85% of what we consume comes from these awful factory farm operations. And our biggest potential is to release land back to nature and capture carbon by eating less meat. If we all transition to a plant-rich diet, we would release the size of land that is Scotland. back to nature and carbon storage. So the size of Scotland, and we could still feed ourselves, and we could actually have a horticulture industry, because we currently import more than 50% of our food, mostly fruits and vegetables. I just can't reiterate enough how this land use issue is not called out enough. It's hugely inefficient to feed farm animals 5 times the food that the entire human population eat. So then the question of, well, what is sustainable farming? And I was saying to some of you at the start that my father is a pioneer of conservation agriculture, and it's one of his high points now to see that his work has been cited in panel 5 of the Eat Lancet document, if you want to go and read it, because conservation agriculture is the sustainable and ecological way to intensify farming at scale. And it does not necessarily rely on animals. It doesn't need animals at all. That's a choice we make as a society. And it's based around minimally or no mechanical soil tillage, permanent biomass cover, and this diversity of species. And so, yeah, please look at that. And we've got a page on our website about this called Sustainable Farming, and a webinar you can watch. And a reminder that this is a justice issue. Nobody is doing well in the current system, but we have to make the most change in high income countries. 30% of people drive more than 40%, sorry, 30% of people drive more than 70% of food related environmental impacts. If we all ate like the UK, we would need 7 planets to feed the world. So it's a call to action now. I like this paper that's recently published by Hugh Montgomery in BMJ Leader, talking about the 4 Ps of professional practice for sustainable healthcare. And we can put actions we can take for the food system into these 4 Ps. We can educate ourselves and adopt a plant-rich diet. We can use this knowledge in our professional practice. We can use it with our patients, put it into guidelines and impact policy. And that's what we try and do as an organisation, but everyone needs to do that with their voice. And just a quick quote from an article that we published in the Future Healthcare Journal, that embracing plant-based diets is now an ethical imperative with benefits spanning individual health, environmental sustainability, equitable resource distribution, and global health justice. So we have no choice, yet we have a lot of solutions. So thank you very much.
Thank you so much, Shireen. Wow, so much to think about there. And I really hope that you were feeling the love from everybody, because loads of people were sending up little thumbs up and little hearts to say how wonderful that was and how useful that was.
Thank you.
Yeah, brilliant. Thank you very much. There's a few questions in the chat. There's one from Phil saying, if we were to put forward an Eat Lancet project at our trust, i.e. taking meat off the menu, say, I mean, that's not quite what Greener by Default sort of suggests, but that was where he was coming from. Do we think there's a real saving? I'm not talking cost avoidance, but actually monetary benefit. Any financial appraisal studies that can help bring this higher on the agenda? Just to be clear, no doubt it is the right thing. I'm thinking about influencing decision makers to get this higher on the agenda. The money talks. And Ramina's posted on there the data from New York. Is there anything you want to add to that, Shireen, to answer that question?
No, but I do agree. And I think we do need to have the language and messaging right. We're not removing anything from the menu. That always backfires. There's data out there that meat-free days backfires. People either exit the canteen and they're go and spend their money on eating animal foods elsewhere, and then retailers don't get the revenue, and then it's back to status quo because it didn't work. So this is not about taking anything on the menu. It's behavioral nudges. But yeah, I agree. Return on investments is what everyone wants to talk about and know about. So there's been some modelling studies. I referenced them in one of the slides. So the Conservative Animal Welfare Organisation, the Office of Health Economics, they've all modelled this. So we've got a modelling example. Then we've got the New York City, who have quantified the cost reduction per meal, 59 cents per meal reduced if you're eating the plant-based meal compared to the animal-based meal. And we all know that the cost of meat, eggs and dairy is increasing for obvious reasons. If we actually paid what we should be for the on costs of that, it is expensive, whereas beans and grains and things are relatively cheap when you're doing this at scale. And so we've got knowledge from a 2021 paper by Marco Springman as well, that globally, if we were to shift to more plant-rich diets, it would save the individual a third in their kind of shopping expenditure. So We need more. And of course, as we expand our pilots and making that business case and a toolkit for people to just hand out is obviously part of our plan. So hopefully we can have that so everyone doesn't need to reinvent that themselves.
That's lovely. Thank you very much for that. And I think that's a really important thing to point out, isn't it? That I think for me, that was a massive shift when I talked to Greener by Default and to you, that we're not talking about stopping things. We're not talking, or at least we're not talking about denying people things. I think that was a massive shift in my thinking that really helped me to appreciate how this could be adapted more widely. So that was really useful. Lauren's put a question, and I'm not sure I'm familiar with whether she's meaning GBD as greener by default. I think, but how do the benefits from the Eat Lancet diet compare to the greener by default advocacy for milk stroke calcium consumption on health outcomes? I wasn't aware that greener by default were advocating for milk, so I'm just wondering if she means something different by GBD. Lauren, I don't know if you can put in the chat if you're meaning something different there, or I could unmute you potentially.
Oh, global burden of disease. Yeah,
Oh,
sorry.
okay.
Yeah, thanks,
Thank
thanks,
you.
thanks,
Yeah,
Lauren. Yeah, that makes sense.
that makes much more
Yeah,
sense.
yeah, yeah. So, yes, I agree. So, global burden of disease does reference dairy as a source of calcium, and that's if we're thinking in a UK context, we do get quite a lot of calcium from dairy products. That's become normalised. I mean, it's a whole different story about why and how that happened. But yes, dairy is a source of calcium, and we need sufficient calcium in the diet. But that again is modelled in the Eat Lancet Planetary Health Diet, in the main Eat Lancet document, and then that paper I showed you by Nita Faruhi, and showing you that, assuming we adopt a healthy whole food diet that emphasizes also the foods that are rich in calcium, which are the same foods that cows eat, greens and beans. And then, of course, fortified plant-based milks, if people are used to that, need it as a transition, that's fine too. So I don't see that as a major barrier. Calcium intake is important for colorectal cancer prevention, for example. So we've got used to saying dairy equals calcium equals colorectal cancer reduction, but there's nothing special about the dairy. It's a vehicle for a nutrient. You could say the same about lots of vehicles of for nutrients. So we have to get it from there. Yeah, animal cheese is a huge issue. I don't know what that means, but yeah. So I think we should be, shifting our norms and getting calcium from where it comes from. It's a mineral in our soil, and we can eat plants that are rich in calcium.
That's really useful. Thank you. And Lawrence just commented, I think it's just a comment. I had a traditional dietetics education. I'm still concerned by those issues. And then Romina has obviously shared, as I say, the New York hospitals data. And she said, I'd also be interested to hear if there's any data from UK hospitals, e.g. Southampton. So I think you partly covered that, didn't you, in your slides? I don't know if you want to add anything to that.
Well, only I didn't show Southampton data
Sure.
because they did a slightly different but overlapping similar type of thing. So it wasn't work with Greener by Default or Plants First Healthcare. They again had a champion within their catering team who did make changes to the types of meals offered, the way it was offered, and they've shown reductions. So I don't have that data at hand. It's not my data particularly to share, but yes, Southampton Hospital have done some good work, again, without removing anything, but just prioritizing and also thinking about the sizes of the meals and common sense things like don't serve an orange unpeeled to somebody who's never going to peel it. So they've done a lot of work with food waste, which of course is another way of reducing environmental impact. But the question about yeah, so to Lauren, who's a dietitian, obviously we're working quite closely with Tanya Hafner and the BDA Sustainable Diets group, and please do take it back to your professional body as well. But I don't think, well, the Planetary Health Diet has looked at all of those nutrients that everyone's worried about and given ways and strategies of making sure intakes are normal. But your blue dot, your one blue dot initiative from the BDA is excellent at that as well.
Oh, that's really helpful. Thank you. And then Rosemary Martins posted a paper on the nutritional adequacy of the Eat Lancet Planetary Health Diet, which sounds like it would be a very useful thing to look at. I shall certainly be looking at that because that does sound very useful. Then there's a question about cost to individuals, because I think that the issues around sort of institutions changing their priorities are slightly different, aren't they, from issues for individuals? And Tim's posted, considering the increased cost of a plant-based diet for those in the most deprived households and the lack of access to a simple household appliances such as a fridge or a cooker, but are vital in a balanced plant-based diet, how can we ensure that inequality is not widened through this and stigma reduced around poverty? I think that is quite a major issue, isn't it? Because that was one of the criticisms that came out of the Eat Lancet plate, and in fact from the Eat Well plate as well, before, that had nothing to do with the planetary health side of things, that that it's a large proportion of people's income that they would spend on food. So yeah, that would be great if you could cover that one for us.
Yeah, thank you. And I think that's one of the key things around the latest publication, is that justice has been a separate work stream in addressing those inequalities. The current food system, the status quo, is hugely inequitable. I think the latest data from the Food Foundation says that 1 in 7 households can't afford healthy meals, and of course that affects those of low socioeconomic status the most. We can't fix everything immediately, but we can advocate for better policies that make healthy, sustainable, nutritious diets available for everybody. The status quo it does not make that happen. So it's around all the things that we've put in the 10-point plan. We need incentivization for farmers to grow the food that promotes health. So horticulture, we've lost it all. We need horticulture in this country to grow our own fruits and vegetables. We need to support these farmers to do so. We need subsidies to be shifted away from the damaging foods, the meat and dairy, and shifted to the foods we want everyone seeing. And then, we need to be able to have those available at a price point that is accessible to everybody. I mean, currently, we have that problem. I don't think there's any evidence that shifting to the planetary health diet will change that. I think that needs to be a system, policy, government wide, top-down strategy that we're hoping to see and are certainly advocating for from the National Food Strategy. So the foods we want to eat, the foods we want to grow and eat for health and the planet, need to be supported by the relevant policies. So I don't think it's any different from the terrible situation we're in now. I don't think it will make it any worse.
That's really useful. And Deborah said it doesn't have to be expensive, all about education. Both of my brackets vegan, now adult kids fed themselves through uni on a shoestring. I have to say my daughter's feeding herself on a shoestring, but that's because she mops up everybody else's food waste. The other students waste so much food, and so she hardly spends anything on food, but that's a slightly separate issue.
Yeah,
can
I just
go on? Yeah, go on.
add that we do have a plant-based on a budget fact sheet. Most things are less than £1. It takes into account people who don't have the ability to cook. So, it's all possible, but I do recognise it requires time, knowledge, and some skills and change in mindset. And, I do also recognise that, you're not going to try things on a whim if you've got children who'll only eat certain things because you don't want that waste as well. So there's numerous issues that need to be addressed. But
no, that's really helpful. I think one of the issues in terms of inequalities is the whole factor of how people shop, isn't it? And if they can only manage a weekly shop, that then they have to stock up on all sorts of things, that there's always the worry about food waste in terms of things that are perishable. And I think that's one of the big sort of shifts that we need to make in how we, shopping locally, for example, that actually doesn't require one big shop where lots of things go off, and for more perishable plant-based food. So Lauren's asked a really good question, which I know has been an issue for my sister who's been in hospital, and she raised this very issue actually. Are there any digestion/absorption exacerbations from using such a diet in hospital settings? So I suppose there's stuff around, whether people, if they're changing their fibre content or whatever when they've had bowel operations and that kind of stuff. What's your view on that one?
Well, I mean, firstly to say I'm not a registered dietitian or a nutritionist, so one would always seek professional advice for these, less common issues. And we're talking about normalizing for the majority of people. And so you can have bespoke menus for people who might have had parts of their gut removed on a low fiber diet. You can certainly do low fiber on a plant-based diet as well, if that's what we wish. But we have to find these ways. I know we like to come up with challenges and problems, but we've got a big problem to solve. Yeah, we know the challenges. So yeah, let's come up with low fiber, plant-based meals that don't irritate somebody who's had surgery. And certainly they already exist. Examples exist because obviously we need to meet the requirements of vegans and vegetarians when they're in hospital. So there's many examples, and you can see it on our frequently asked questions actually on our website of institutions that have developed those sorts of things. So I think we need some imagination and some change of norms, and we can't stick with what we're doing currently. But coming back to the fact that nothing's off the menu. So if your patient requires a fiber-free diet, which equals no vegetables or plant foods, then of course that's always going to be available on a specialist menu through the input of a specialist dietitian.
That's brilliant. Thanks, Shireen. And we're coming to the last 5 minutes, so we'll just zip through anything else that's come out as themes. So Jasmine's mentioned about greener by default and that they're going to try and work with them, which sounds fantastic. Yeah, so Phil was wondering about the tracking of obviously it's easier to do in inpatient services, but as a community-based trust, it's much harder to track the food impact. And he said, I suppose the angle is training, education, and contribution to care plans, but it's obviously going to be harder to track in community settings.
Yeah. Well, I can accept that criticism.
Yeah.
I would like to answer Sean's question there, though, about celiac disease and oat milk. So again, we're saying defaulting, normalizing something for the majority. Celiac disease is going to be relevant for what, 1% of the population. Lactose intolerance is relevant to 60% of some people of color, depending on where you are, like me in Camberwell. We're going to have a lot of Indians and Africans that are lactose intolerant. So I mean, I think we're not saying oat milk is the only thing. We're saying it's the normalized default option, just the way that cow's dairy is a default at the moment, but you can ask for something else. So it's just flipping the norm. So there's also, that's the same. If you're celiac, you need to ask for gluten-free and many food items, but not everything on a menu is gluten-free in hospitals.
That's great, thank you. I know there's a lot more questions popping up now, so which I've sort of struggled to keep up with really. Are there any others that you want to pick out particularly, Shireen?
Well, I'm right at the bottom of the queue there, and somebody said soya milk preferable to oat milk for health. Well, I guess it depends what you're using your milk for. And like in the canteen setting, most people are just putting a little bit into their tea and coffee. I don't think that has any health impact on anybody. Like it is just something we've got used to doing. But yes, if you're going to look at randomized studies, and there was a big meta-analysis at the end of last year looking at all the randomized studies comparing cows' milk with soya milk, and it showed improved cardiometabolic outcomes in these studies for those consuming the soya milk, regardless of whether it was sweetened or not. So the degree of evidence we have is supportive of soya milk for health, but it kind of depends as an adult what you're using your milk for. Don't know. Yeah, if you're having it in your oats, I love soya. It's got great benefits for men and women. But equally, I don't think if the rest of your diet is full of colourful, plant foods and lots of beans and lentils, if you had oat milk, it would have any significant impact on your health at all.
That's brilliant, thank you. Yeah, there's a question here about India, Islam, where animal dairy is used mostly. How can we make shift to plant-based dairy? And I suppose that just slightly raises the question of different agricultural systems in different countries and how that impacts the choices that are made in terms of the shift.
Yes, absolutely. But I mean, if you look at it was a question about India.
Yeah, well, there was a comment from Priyal just saying India is the land where animal dairy is used mostly. How can we make a shift to plant-based dairy? Yeah.
Yeah, I mean, I'm not going to pretend to be an expert in the Indian food system, but I'd only say that India is the biggest producer of dairy globally, and this is not happening with cows on green fields. It's happening in factory farmed operations. So they, our reduction in reliance on cows' dairy is just shifting to places like China and India, who are enormously increasing their industrialized dairy farming. What we do about it, I don't know. We need countrywide solutions, but we also need to regulate the industry. Yeah, I mean, I focus on the UK. I haven't got an answer to every global problem.
That's fair enough. Oh, that's superb. Thank you. And there's a lot of questions about whether the recording is going to be available. Yes, it is. It's going to be on the Greener Practice website. So watch this space. It'll be put onto the YouTube channel as soon as we've had a chance to edit out Shireen and me and Emily chatting at the beginning before you all arrived. So that will be going onto the YouTube channel on the Greener Practice website. There was a comment about whether it could be made available for MedAct professionals as well. We can certainly discuss that with Shireen.
Yeah, or invite me to give a talk to MedAct and a member. I'd love to come.
Yeah, you're very wonderful to give your time to everybody so freely, and we really do appreciate that. It's been a huge privilege to hear you today, and such an erudite talk and such a positive response to it as well. So we're incredibly grateful. I'm really sorry for people who we weren't able to answer their questions, but you can see just quite how much interest has been generated. And I could perhaps see if I can save the chat, and if there's anything in there that you want to answer afterwards, Shireen, you could perhaps do that. Maybe on our website we could have a question and answer bit or something like that, perhaps. Yeah. I'm going to finish because we've reached 2 o'clock. But thank you all so much for attending, and do get in touch with Greener Practice. We can feed the questions back to Shireen if that's okay with you, Shireen.
Yeah, no problem at all.
As well as collecting the questions on the chat. So thank you so much for coming, and I'm really grateful to Shireen for her time and expertise.